Hello! In this video, we're going to talk about the health of your lungs and bronchial system, the causes of chronic cough, and how to support your respiratory system, especially when dealing with bronchitis. Most people know that smoking is very harmful to the lungs, but there are other factors that can cause just as much or even more damage. Let's take a closer look at them. Blood pressure medication and chronic cough. When someone has a dry cough that lasts for weeks or even months, but they're not sick with a cold and don't smoke, finding the cause can be challenging. Doctors often struggle to give a clear diagnosis and might suggest something vague like asthma without attacks or chronic bronchitis of unknown origin. As a result, treatments don't help, and the person continues to suffer from an exhausting cough. But one commonly overlooked cause is the side effect of medication, particularly drugs used to lower high blood pressure. Some of these medications can trigger a persistent dry cough in a large number of people. This is something that's often forgotten during evaluation. In most cases, the leaflet for these drugs clearly lists cough as a possible side effect. The mechanism behind the cough isn't related to allergies or inflammation. Instead, it's a pharmacological reaction. The medication affects the receptors in your airways, making your body react to normal stimuli as if they were irritants. And as long as the person keeps taking the medication, the coughing won't go away, no matter how many tests they do. If you've had a lingering cough with no clear cause and you're taking blood pressure medication, your first step should be to check the package insert. Look for the side effects section. If cough is listed there, talk to your doctor about switching to a different drug that doesn't have that reaction. Never stop your medication on your own. This must be done with your doctor's supervision. Low-fat diets and lung problems. In recent years, low-fat diets have become very popular, especially among women and young people who want to stay slim. Many of them remove even healthy fats from their diets. In some cases, the diet becomes so fat-restricted that the body starts to experience a shortage of essential fats. Fats that are crucial for the function of vital organs, including the lungs. Here's why it matters. The lining of your airways contains a thin layer of fat that plays a protective role. Without enough lipids, the tissues become dry and more easily irritated. Even mild cold exposure can lead to inflammation. Fats are also needed for producing hormones, immune cells, and enzymes that help defend your bronchial system from infections. A lack of dietary fat, especially in children, elderly people, or anyone with a weakened immune system, can lead to more severe bronchitis, long-lasting coughs, and increased sensitivity to viruses and bacteria. In traditional medicine, fats have long been used to treat coughs. For example, warm milk with butter and honey isn't just an old-fashioned remedy. It's a way to soften irritated airways, loosen mucus, and relieve bronchial spasms. Even something as simple as a small piece of butter a day, about 20 grams, can help support the respiratory system, particularly in colder months or during chronic illness. Nutrition for weak lungs. Sometimes a cough isn't caused by illness, but by overall weakness of the body. If someone is underweight, pale, often sick, and has a weak immune system with frequent respiratory infections, this could indicate a lack of proper nutrition, especially a shortage of fats and proteins. In many cases, people avoid meat and fatty foods for ideological or dietary reasons, but lungs, like any other organ, need proper nutrition to function. Without it, the lungs become less resilient. Even minor irritation can trigger a cough, colds become more severe, mucus doesn't clear properly, and mild inflammation can drag on for weeks. The solution in such cases is to adjust the diet. You don't need to eat a lot of fatty food, but adding a small amount of natural butter to your breakfast can already make a noticeable difference. In some cases, adding a small portion of animal fat or fatty fish a few times a week can help restore the fat balance and improve the lungs' ability to resist irritants. There are situations where just improving the diet without any antibiotics or strong medications leads to a significant improvement in respiratory health. This is especially true for younger people following strict vegetarian or fat-free diets who don't realize that their frequent colds are caused by nutritional deficiencies, not infections, when antibiotics are actually needed. Cough can be caused by many different things, from allergies and irritation of the airways to viral or bacterial infections. If a doctor examines you and confirms that the cough is due to a bacterial infection in your respiratory system, then antibiotics may be necessary. But it's important to understand that antibiotics only work against bacteria. They have no effect on viruses, which are the cause of most seasonal colds and bronchitis. If you've started taking antibiotics and after 2 or 3 days there's no improvement, if the fever, weakness, and cough remain the same, there's a good chance the medication was either the wrong choice or simply not needed in the first place. That's why continuing antibiotics without a follow-up consultation is not recommended. Also, long-term or uncontrolled use of antibiotics can weaken your immune system. These medications destroy not only harmful bacteria, but also helpful gut microbes. This can lower your body's natural defenses and even lead to fungal infections or worsening of lung health. That's why it's so important not to self-prescribe antibiotics. If your doctor recommends them, they should be used along with immune support, proper nutrition, and close monitoring. If there's no progress, the diagnosis should be reassessed and the treatment plan adjusted. How to strengthen the immune system during lung illness. When a cough becomes prolonged and the lungs are weakened, it's not enough to just manage the symptoms. The goal is to help the body recover. Supporting the immune system is key. A healthy immune response can fight inflammation faster, clear mucus more easily, and prevent complications. One of the most reliable and gentle ways to support immunity is with medicinal plants. Natural remedies with anti-inflammatory, antimicrobial, and general strengthening properties. When used correctly, they don't burden the liver and don't cause dependence. Aloe with honey and butter. This is a classic remedy for chronic cough and weak lungs. Aloe helps heal mucous membranes, honey works as a natural antiseptic, and butter soothes the airways. If you have a homegrown aloe plant, take a few thick leaves, chop or crush them, and mix with equal parts of honey and unsalted butter. Stir well. Take 1 to 2 teaspoons of this mixture 3 times a day with meals. Drink warm, not hot tea afterwards. Use this for 5 to 7 days. If you don't have a fresh aloe plant, you can buy bottled aloe juice at the pharmacy. Just make sure it doesn't contain alcohol. Ask your pharmacist for a pure, non-alcoholic version. Chamomile flowers. Chamomile is one of the few herbs that works in several directions at once. It reduces inflammation, fights microbes, relaxes the smooth muscles of the bronchi, easing spasms. Brew chamomile as a tea. 1 teaspoon per cup of boiling water, steep for 10 to 15 minutes, and drink warm 3 times a day. Use this for 2 to 3 weeks. You can also use the same tea to gargle if you have a sore throat or tonsillitis. Licorice root. Licorice is well known as an effective expectorant. It helps thin mucus, reduces inflammation in the lungs and bronchi, and strengthens the protective lining of the airways. It can also be helpful for digestion and soothing gastritis. You can buy licorice as a syrup or as dried root to make a tea. But there is an important limitation. Do not take it for more than 10 to 14 days. Overuse can disturb your body's salt and fluid balance. Always read the instructions and check for warnings. For example, people with high blood pressure should avoid it. Pine buds. Pine buds are rich in essential oils and active compounds with strong antiseptic and expectorant effects. Brew them as tea or prepare a decoction. It's best to take this regularly over a period of 3 to 4 weeks. Pine buds are especially helpful for chronic bronchitis, productive coughs, and low resistance to infections. Eucalyptus tincture for gargling. Eucalyptus is a powerful natural antiseptic. The tincture is available at most pharmacies. To use it for gargling, dilute 10 to 15 drops in a glass of warm water. Gargle 3 to 4 times a day for 1 to 2 weeks. Before gargling, it can be helpful to do a special breathing exercise to open up the throat. You can find demonstrations of this online. It helps the solution reach deeper areas of the throat and work more effectively. General recommendations. No matter the cause of the cough, there's one rule that always applies. Your body needs enough fluids. This is especially important if you have a fever, inflammation, or thick mucus. Warm drinks help thin the mucus, flush out toxins, and maintain electrolyte balance. The best choices include cranberry juice, lingonberry leaf tea, and herbal infusions like linden blossom or thyme. These drinks keep your airways moist and also offer gentle anti-inflammatory benefits. What's important is to drink regularly, in small sips throughout the day, and to avoid cold or very hot drinks. These were the most effective and reliable recommendations for treating cough and strengthening the lungs. Always talk to your doctor before trying anything new. Self-treatment can be risky. Now we'd like to hear from you. What has helped you personally manage cough or bronchitis? Have you used any home remedies, breathing exercises, or herbal treatments? Let us know in the comments. Your experience might help others. Thanks for being with us. Subscribe to the channel, stay tuned for new videos, and take care of your health.